It is a form of blindness that some call especially cruel. People with choroideremia are born with perfect vision, but then they start to lose their sight. Researchers in the U.S. are building on a clinical trial overseas, and they're about to test a therapy designed to stop the disease and maybe even reverse some of the damage. In bright daylight, 10-year-old Mark DeVoe has no trouble seeing his friends.
I'm gonna pick now.
But inside, or even in the shade, Mark's eyes sometimes don't work.
I have trouble seeing like trees, when the road ends and when there's like a drop there.
At age 6, Mark's doctors diagnosed him with the genetic condition choroideremia, which causes people to progressively lose vision until they're completely blind.
I don't know what it's like to live in darkness, but I've seen it.
Susan is a carrier of the blindness gene. Mark's grandfather has the condition.
Watching my father go blind was devastating. As a little girl, you know, you count on Daddy to do things, and Daddy couldn't do them.
Dr. Jean Bennett is one of 2 U.S. researchers preparing to test a gene therapy for choroideremia in humans.
I think gene therapy holds a huge promise for developing treatments for blinding diseases.
Researchers will use a virus carrying a normal choroideremia gene and inject the virus just under the retina. The gene should begin to work in a few weeks. In a trial of 6 patients in the UK, all 6 had better low-light vision 6 months after the therapy. 2 of the 6 could read more lines on an eye chart. Dr. Bennett says early success in the UK is encouraging.
If we can prevent the disease there from continuing, it would change people's lives.
I want my son cured. I want to see all these guys who it breaks my heart to see walking around a conference with white canes. I want them to have freedom.
And a chance to enjoy all the fun that comes along with being a kid.